Hello everyone. I'm here to talk about the current challenges that the industry is facing with the existing prior authorization process. We talked about what a prior authorization is. And at this point of time, across the country, there is no specific standards or methodologies that is enforced by any standards organization or by CMS to adhere to a specific prior authorization approval process. So if you look at it, it is an extra burden on the providers when they submit a prior authorization request to a payer. A provider could be working with multiple payers across the country, and if each payer has a different set of methodologies for a prior authorization request to be submitted, it becomes extra complex, and it's becoming very confusing for the providers to submit a prior authorization request. And the most glaring challenge with respect to the patient is it is a very time consuming process. The current prior authorization process could take several weeks actually before it gets approved or denied. So a patient who's waiting for a medical treatment to be started, it becomes a overwhelming um, delay before they can start the treatment plan. Actually, the whole process by itself can be very exhaustive. The reason being, a lot of documentation is required by the payers before they can approve or deny a prior authorization process. With that said, the provider has to collect a lot of information and has to submit along with the request for the payer to make a decision for this prior authorization. There's a lot of manual review process, and you also need to have very efficient medically trained staff, because the details are going to be exhaustive, and the details that are going to be submitted as a part of the documentation requires a very well trained medical staff before a prior authorization can be approved or denied. Additionally, many providers and pharmacists are not aware of the fact that a particular medical treatment plan requires a prior authorization or not until they gets their claims denied. So there is no current check processes unless otherwise there is a manual process for a provider or a pharmacist to call the plan and then find out if a prior authorization is required or not. Patients are most often faced with difficult decision because when they avail a medical treatment or a medical drug, they don't know if this is going to be covered by the coverage or they have to pay their full prices. So these are current challenges that the existing stakeholders face in adhering to this current prior authorization process. So it has a lot of complexity for the providers. Payer has to spend a lot of effort and resources on training the medical staff to get the prior authorization approved, and the patients have to wait for a longer period of time to get their medical treatment plan or to get their drugs made available for them to start the treatment. So these are the current challenges of the prior authorization process. Thank you.